American Cancer Society released results of their studies last year that showed that we had an increase of 1% per year in the breast cancer diagnosis. So 1% incidence increase per year. And that's higher in women under 50. It's about 1.4%. So there is something that's happening that is increasing their incidence.
Someone getting ready to get a mammogram done or get their assessment done, why they shouldn't have any fear trying to get this assessment or a mammogram done.
The other thing we can do is make sure we're getting those screening mammograms. And that is the one thing that has been proven year after year after year to reduce morbidity and mortality. The second thing is, if you feel something, do not wait. Just advocate for yourself.
Hello. This is Kenny Perkins, aka your cancer guy. And again, as always, we have brought to you another guest, a phenomenal guest that's going to talk to you a little bit about breasts, right? We talked about breast in Breast Awareness Month, right? It's a big topic, obviously, in October, but it doesn't stop there. There's life after October. And so we have brought in a specialist, a radiologist, and we want to talk to you about how you get your screening. A lot of times people get nervous about screening or they don't know what to ask for. Some people have things in their breast and is it cancerous? Is it not cancerous? So we want to make sure we're going to talk to the best today. And we go to Chicago to do that. This next guest is not only a specialist, but she is someone who cares deeply about you. And so let's pick her brain today. Let's ask her the right questions and get the gems so that you can benefit from it. And as we say, Mrs. Bole, Dr. Bole, it's an amazing name. So Dr. Bole, welcome to All Talk Oncology. And it's an honor to have you here today. Hey.
Thanks for having me. I'm so excited to talk about this important topic.
It's our pleasure.
Yeah. Thanks for having me. I'm so excited to talk about this. And, you said at the beginning, October, there is life past October, but you know what? Breast Cancer Awareness Month is every day. It's every day. It's every day in my field and what I'm doing as a breast radiologist. And every woman out there that meets criteria for screening mammogram, it really should be our everyday conversation. So I love the fact that we're actually doing this in December.
Absolutely. For sure. Every day. Listen to me. So, Dr. Bole, talk to us a little bit about the screening, because I think a lot of times, one, we're getting used to women starting to take initiative in screening themselves, which is awesome. We want to do that more. But talk to me about the process and how a person should go about getting their screening done.
Yeah, so I think that one of the most important things, I guess, just to kind of set the scene for this conversation, is I think the most important thing we can do for this is to really empower women. So make this a casual conversation because there's so much anxiety that comes about when we talk about mammograms. People are so nervous, and I get it. If my Instagram feed is full of talking about breast cancer, and it's really, really scary. And so I think the more and more we can just talk about this as a casual conversation, the more important it is. So I think women really, really are now taking the initiative and being empowered and kind of being in control of their own health. And I noticed that so many of my patients actually know more about breast imaging than even their own primary care providers. And I think that's because there's so much good information out there. And we're getting the word out with these conversations, which is so important. But I think the bad thing is there's actually so much misinformation out there too. And that's why I think it's important that we talk about this, not only in a casual way, but in an evidence-based way, talking about what the literature shows. And I think one of the most important things that has changed just in my I've been practicing for a decade. I finished fellowship in 2015. And just even in a decade, I think there's so much that has changed from in terms of what we're recommending for screening. So I would say when I started, it was kind of all women by age 40 should be getting mammograms every year. And now it's actually changed to all women by the age of 25 should be risk assessed. And that is a recommendation from my societies, the Society of Breast that we follow as breast imagers. So the Society of Breast Imaging and the American College of Radiology really backs that all women by the age of 25 should be risk assessed. What does that mean? It doesn't mean genetic testing, because that's what people get confused about. They're like, oh, I need to see a geneticist. No, that means an algorithm. It needs to be done to see what your risk of breast cancer is. So the most common one we use is called the Tyrer-Cuzick model. And it's actually one that Olivia Munn has really talked about because she went through that risk assessment with her primary care physician, her OB, and found out she was an elevated risk. And if you're an elevated risk, if you're under 40, that might mean screening mammogram before 40. And if you're at 40 or older and already getting screening mammograms, that might mean adding in an MRI for extra screening, which she did, and they were able to find a very small cancer that way. So I guess we should start by all women 25 risk assessment.
So how does that go happen, right? I mean, if you're a doctor, if you are a young lady and you go to see your primary, a lot of physicians are not having a risk assessment. They may not even know about that. So
Right.
how should they go about doing that? They walk in and say, "Hey, can you give me a risk assessment for my breast? What does that consist of?" Break that down for us.
Yeah, I think this is a great question because I think I don't know the exact answer for this. We as a society are trying to get this out to primary care physicians, but not all know this yet, right? And so I think the conversation is going into your doctor and saying, "Hey, I heard on a podcast, I saw in the literature, I saw in the media, I saw in the news, all women should be getting risk assessed by 25. Is that something you can do for me?" And your primary care provider might say yes, like Olivia Munn's primary care provider could say that. But some providers might say, no, I'm not really sure exactly how to do that. And you can actually do it online. So you can do it online. You can Google the Tyrer-Cuzick model and you can find that. A lot of institutions like the one I work at, you can actually find a risk assessment calculator on their breast imaging website. So it's very easy to kind of find places that you can do that. I know the Know Your Lemons Foundation, it's an organization, they have one on their application. So a lot of places do have that and you can really do it yourself. The other option you have is if you already have a family history and it's kind of on your radar, you can actually be seen by a high risk clinic. A lot of times those are your breast surgical clinics that have high risk clinics and kind of nurse practitioners or PAs that also might be able to run these risk assessments in a more professional or formal way, but you can absolutely do it yourself as well.
And listen, don't worry. If you guys don't know what that criteria is, we're going to bring it to you in All Talk Oncology. We're going to make sure we post this. We're going to make sure you have access to this so
Mhm.
that you can walk in with something and say, hey,
Yeah,
this is the risk assessment and this is what I would like to have done. So don't worry. All Talk Oncology is going to make sure you guys get that. So thank you
yeah,
for that. And you know what? I didn't know. I didn't know that there was a risk assessment for people who are 25 years old walking in. So this is great.
yeah. I think it's something that is just so important for us to be able to talk about. And the caveat to this, I should tell people, is that your risk might be overestimated. So it might be overestimated sometimes on these risk assessments. So don't panic. If you get a higher risk on an online algorithm, get into a high risk clinic and have them do it in a formal way to make sure. So that's where I would start with screening.
Yeah. Well, you know, it helps when the physician is more inviting. It's not
Yeah.
scary. You know,
Yeah.
you make this seem so inviting, which is important. You know, someone getting ready to get a mammogram done or get their assessment done. Tell us a little bit why they shouldn't have any fear trying to get this assessment or a mammogram done because I mean, it can be a little overwhelming.
Yeah. Absolutely. So again, I think any fear should always be turned into empowerment. And I think if we understand what we're to expect, I think that that fear is a lot less. So let's say you find out when you should be getting a mammogram. So every woman by age 40, if you're a higher risk, it might be before that. You come in for a screening mammogram. So a screening mammogram is screening somebody without any symptoms at all. So you're coming in, you come into your appointment, it takes usually about 20 minutes, usually a lot less. You kind of come into the waiting room, you are handed a robe. I always tell people this is when I say, actually what you wear matters because people will come in a dress and you actually have to put a robe on. And then when you go into the room, it can be a little bit hard when you don't have pants on. So I always tell people to wear something on the bottom because that way you can just take off your top and put on the robe. And then you'll go into the room with the technologist. It can be a little bit uncomfortable or awkward because you do have to undo your gown and your breast will be placed on the mammogram machine. So again, I just talk about it usually. The secret is I actually hate getting my mammogram. I'm a breast radiologist and I hate it because it's not the most comfortable thing in the world. But if you can just remember you're doing this because you are trying to find something early at a stage that you can't feel something, I think it can make it mentally a lot easier. So your technologist will place your breast on the mammogram machine And we'll do 2 pictures of each breast. It's more if you have implants, you'll need 2 additional pictures. The mammogram machine does add that compression that everyone hates. But again, I think if you know why it needs that compression, then I think it can make the exam a little bit better. It's because the compression actually spreads the breast tissue out so the breast radiologist can look through the tissue. But the second thing is it actually decreases the amount of radiation needed in order to get that picture. And I know you deal with radiation every day, that you do. So do I, in a different way. So I use the radiation to take the pictures. And we want to minimize that amount of radiation that we're actually giving the breast for the picture. And so that compression helps with it. And then you leave and you get your results in the mail or on your online portal if it's a screening mammogram. Every institution has 30 days by law to give you those results, although usually that turnaround time is much quicker.
Yes. Now, I heard you earlier, you talked about using MRI. Is that something new that's being utilized in the breast exams now?
Yeah, so an MRI is something that we're really using a lot more, I'd say, in the last few years. So it's been around for a very long time. It used to be more for patients that had high risk. If you're greater than 20% risk of breast cancer, then we would do MRIs. But now, and then if you have breast cancer, sometimes we would use it in specific cases to look in the breast and make sure that nothing else was hiding on the mammogram or ultrasound and nothing was hiding in the other breast before you went to surgery. Now we're using it more and more as a screening tool, even in patients that have dense breast tissue, which I think is a whole other topic we could talk about that's important. But we're using it to screen people also that might not just be high risk, but may just have dense breast tissue, which makes it harder to see through on the mammogram.
Yeah, that's a big issue because a lot of times I'm seeing a lot more young people come in for treatments than
Mhm.
ever before. Been doing this now for about 2 decades. And so to see more and more young people, you're like, what's going on out here? So
Yeah.
it's important. It's important that you ladies out here, no matter 25 and above, get these tests done.
Mhm.
Right. So talk to me. I mean, what is it that you like to tell your patients coming in? Because I mean, breast cancer is on the rise. It's an unfortunate thing. So how can we get ahead of that curve?
Yeah, you're right. I mean, unfortunately, breast cancer is on the rise. The American Cancer Society released results of their studies last year that showed that we had an increase of 1% per year in the breast cancer diagnosis. So 1% incidence increase per year. And that's higher in women under 50. It's about 1.4%. So there is something that's happening that is increasing that incidence. There's so many things I think that we can do. I mean, there are modifiable risk factors, right? So we want to eat healthy. We want to exercise. We want to limit our alcohol intake. These are things that we want to do to be healthy, to reduce our risk of breast cancer, but also to just in general be healthier in general. But I think the other thing we can do is make sure we're getting our screening mammograms. And that is the one thing that has been proven year after year after year to reduce morbidity and mortality. So the most lives saved are when we start screening mammograms at 40. And so I think that's one of the most important things that I like to talk to my patients about. The second thing is if you feel something, do not wait. Advocate for yourself. So we want to be doing breast exams on ourselves. The biggest thing that we really kind of talk about now is more important than a monthly exam is really breast awareness. So what does that mean? Know what's normal for you. If you're doing monthly breast exams, but you don't know what your normal is, it's not helpful. And it can actually lead to a lot more anxiety when you feel something. So know what's normal for you. Know what your breasts feel like. It's normal for them to be lumpy. It's normal for them to be flat. Everyone has different types of breast, and it's important for you to know what's normal for you so that you can detect when something is abnormal. So making sure you're looking for things such as skin changes. Are you feeling something that's new? Is there some sort of nipple discharge that's new? And if any of that happens, talk to your doctor immediately and advocate for yourself to get breast imaging. And if you do feel a new symptom, then you'd be coming in for something called a diagnostic examination, where we use mammograms and ultrasounds, but in a different way than a screening tool to be able to kind of figure out exactly what might be causing your symptoms. And that appointment can take a little bit longer. And the radiologist will talk to you that day. You will get your results that day from a diagnostic exam. So I think, modifiable risk factors, making sure you're getting your screening test if you meet criteria, and then advocating for yourself if you notice something new in your breasts.
Absolutely. I love that. There was I don't know, there was a movement, say, feel it on the first. That was one of the ladies that kind of put that out there. And we love that, right? Feeling on the first. So you be feeling your breasts all the time. I mean, you're taking a shower. Is that a time where you can utilize that moment to kind of feel around? If you're married, if you have a husband, sometimes it's the men that find that they're familiar with you. So whatever it is, make sure that you are examining yourself, because I mean, we want to make sure that we get ahead of this curve. If we catch things early enough, then the outcome is a lot better. So to talk about that, I loved, I wanted to mention that. But you mentioned something earlier too, Dr. Bole, and we talked about dense breast tissue. Talk to us a little bit
Favorite
about that.
topic. Okay, my favorite topic to talk about is dense breast tissue. And the reason I love it so much is because it's become more of a coffee talk now with my girlfriends, because laws have been passed, legislation has been passed, which is incredible for women, that women have to be notified of their breast density. So when I talk about you getting results in your portal, on your results will now say your breast density. And there are 4 different types of breast density. There's fatty breast, scattered breast, heterogeneously dense breast, and extremely dense breast. And people always actually get offended by the word fatty breast, but that doesn't mean anything. We're not saying anything about you. We are just saying that all breasts are made up of a combination of fat and tissue. And if you have more fat than breast tissue, then you're not dense. If you have more tissue than fat, then you are dense. And actually, the fatty and scattered breast are the ones you want to have, because they're the easiest pictures to take and they're easiest for the breast radiologist to see through. That being said, 50% of our population have dense breast tissue. 10% of our population has extremely dense breast tissue. And I'm one of those lucky ones that has extremely dense breast tissue. So my mammogram is a breast radiologist's nightmare. You can't see through it at all. And so what does that mean? It means you have a lot of white tissue on your mammogram. But the problem is we are looking for, and you've seen a lot of mammograms, we're looking for white masses or white calcifications, which is really hard to see in a sea of white tissue. So I always liken it to a polar bear in a snowstorm. If you have a polar bear standing in a snowstorm, it's almost impossible to see that polar bear. If you have a polar bear hanging out in grass, much easier to see. So if that mass is that polar bear and you have fatty or scattered tissue, not dense tissue, that mass is going to stand out. If you have a mass, a breast cancer mass, in a sea of a snowstorm, which is dense breast tissue, it's hard to see. And so that's why it's so important for women. So why did we make it so women need to be notified? Because we should be understanding that mammograms are good. They're the only things that have been proven to save lives, but they're not perfect. And they're definitely not perfect in dense breast tissue. And so if you have dense breast tissue, you should talk to your doctor, do your own research, advocate for yourself to get supplemental screening. So mammograms every year, but adding in something else to see through that breast tissue. And depending on the institution you're going to, there are a couple of choices. There's ultrasound, there's MRI. Some people are doing contrast mammography, so adding a dye into the mammogram at the time of the mammogram. So it depends on your institution, but there should be supplemental tests available. And the
Okay.
other thing that you should know about dense breast tissue is that if you have a mammogram and the next week you feel something, absolutely don't say, oh, I just had a mammogram, it's fine. Make sure you're talking to your doctor, because if you have dense breast tissue, you can have things that are masked on the mammogram. And so you might want to go back in for diagnostic imaging to make sure that we're not seeing anything that was hiding.
Extremely important. Thank you. Thank you for breaking
Yeah.
it down. And how does that work, right? Because if I'm coming in,
Mhm.
maybe it's taken so much courage just to get to this point. You come
Absolutely.
in, right? And it's like, oh my God, I have dense breast tissue and I didn't know that, but they're telling me that. Do you guys do an MRI on site, or does that person need to come back again for MRI or ultrasound? How does that typically work?
Yeah, it's a good question. So usually you're not getting your results that day if you're a screening mammogram. And so if, let's say it's your first mammogram and they say you have dense breast tissue, then we never, by the way, we don't know your breast density until you get your first mammogram. So people come in all the time and they're like, I have dense breast tissue, but they've never had a mammogram. So they just think it because of how you feel it. But you can't tell your breast density just by feel. Okay. So you only can see with the mammogram. So that's one of the things I'm always telling people. I'm like, actually, you don't have dense breast tissue. And so if you go in for a baseline mammogram, which we call our first mammogram, and they say you have dense breast tissue, you would have to come back for either that ultrasound or MRI or whatever that you need or your institution offers for dense breast tissue. If you know you already have dense breast tissue, many institutions will let you schedule both the same day. So whatever they do. So a mammogram and an ultrasound, a mammogram and an automated ultrasound. That's another ultrasound that we can do without a technologist. So some institutions you can go in and get both the same day, but it really depends on where you're getting for your imaging.
Thank you so much for that. That's a great education. And so I'm going to make sure I challenge my listeners out there. Do you know your tissue type? Do you
Yeah.
have breast density? If you don't know the answer to that, then you need to make sure you get the answer to that because it's
Mhm.
extremely important. We want to make sure that you're healthy. We want to make sure that you get your screening, and we want to make sure that we're able to locate anything that may be in your breast so that we can make sure that we get it taken care of. So know your breast tissue type.
I love that. You know what? I think that's a great challenge. I mean, wouldn't it be great if you could be like, hi, my name is Sonya Bole. I'm 42 years old and I have extremely dense breast tissue. That's just like a fact you know about yourself. I think that's so important because if you know that, you're so empowered. And it's not to fear. People are scared of having dense breast tissue, but it's more to empower yourself. You should know that. Know that. We've made it a law that you know that. Go look at your report. I love that challenge.
Yes, 100%. 100%. Because guess what? I mean, it's all about being able to get the results that you need so that you can live the life and live a fabulous life and in confidence. For sure.
Hmm.
So talk to us. What you are the specialist in this, and being that you see this awareness or these needs for breast cancer for screening, how many lives do you believe that actually saved or gotten ahead of because of the screening?
I mean, we know that thousands of lives are saved, thousands, hundreds of thousands every year are saved from screening mammograms. The goal with screening mammograms is to catch things before they are felt and catch them before they're in the lymph nodes, because that's when we know the treatments are the best. And over the years that we've had mammograms, millions of lives have been saved. So I think we save lives every day with mammograms. And I think that that's something that keeps me going to work every day, like keeps me reading the mammograms every day, because you never know when you're going to open up a mammogram and find something. And listen, it is hard news to give, right? Giving bad news is a very hard thing to do, especially during the holidays. And I know that we're doing it every day. And I think we just keep doing it because even if we're catching things after they're being felt, even if we're catching things, there are such incredible treatments out there. Our treatments are only getting better and better. And I think we just keep doing it. We just keep saving lives. We keep finding things. We keep treating things. We keep encouraging women. We keep talking about all of this.
100%. And I want to make sure that we power you ladies out there because one of the things women always talk and they talk more than men. Men don't want to talk about their issues of what's happening and they keep that bottled in. But in my 5 years of being able to have this podcast and being able to broadcast it, what I do know is women do talk about it and we love that. And so
Yeah.
continue to be advocates. We want to empower you and make this a part of who you are in your screening, getting checked, making sure that if there's anything you feel, that you get it checked out because guess what? We want to make sure that you're okay. And we want to make that a norm
Yeah.
because more people are getting diagnosed with breast cancer. But if they're getting diagnosed early, then guess what? The results and the outcomes are going to be a lot better. So I'm going to challenge you again with that. So thank you one for being able to talk about it, ladies, but also let's make sure that we empower other women so that they can get it checked out.
Can we do one more challenge I just thought of?
Let's do it. What can we
Okay.
do?
Can we challenge the men out there? Can
Mm,
we challenge the men out there to know two things? One, all of those people, the women that you care about in your lives, whether it's your mother, your wife, your daughter, your best friend, your next door neighbor, check in with them to see if they're getting their mammograms. Check in with them to see if they know their density. I know when my husband's colonoscopy and mole checks are. Why doesn't he know when my screening mammogram is? He's just presuming that I'm getting it done because as women, we get shit done. We get things done. Sorry for that. As
that's
women,
okay.
we get things done. And
Yeah.
so we are going to make sure we're getting our mammograms, make sure our kids' pediatric appointments are being taken care of. We're going to make sure that I'm going to make sure my husband signed up for his colonoscopy and his mole check. But you know what? I want men out there to be checking in with the women in their lives and making sure that they don't need help with something. Can you help them schedule their mammogram? Can you remind them to know what their breast density is? So I think let's get the men involved. It's 2025.
I love it. I love the challenge. Listen, man, you guys got to be out here. Like you have your wife, you have your girlfriends, whatever it is. If they are not getting their breast checked, then you need to remind them. And guess
Yeah.
what? You may be the one who finds that lump. And so it's important that you make sure that they're getting checked out, because it's a loving thing to do. And if you love your partner, then you want to make sure that they're in the best health. So I love that challenge. I love that.
Yeah, great. I think it's important. And actually, and moms and daughters, I mean, I've been having the conversations more with my own mom. Tell me about your mammogram. When was it? And I think we can really just all empower each other, men and women.
Well, Dr. Bole, it's been an honor to have you here on our show today. And before we let you go, I would like to ask you, is there anything that you would like the patients to walk away? I say patients, it's in me. Any of our listeners who are out here, is there something that you would like them to walk away with before we let you go?
I think that there is just so much health anxiety these days. I feel it myself. I don't like getting tests myself. I think that it's very easy anytime you have a symptom to go online and Google it and to find out what it is and kind of just really freak yourself out and panic about things. But the vast majority of the time that you get a mammogram, it's going to be normal. And even if you get called back for additional imaging from a screening mammogram, it should not be a reason to not get your mammogram. Because again, the vast majority of the time, it's going to be normal or normal tissue or a normal type of mass that might form in your breast. And so although we talk so much about breast cancer, the majority of the time, it will be normal. And either way, it should not prevent you from getting your annual mammograms. And I'm just so happy to talk to anyone about anything, any questions that you guys get, please, I'm happy to answer them, because I want people out there, your listeners, to have, again, evidence-based information so that we can really empower ourselves to take the best care of ourselves that we can. And that really starts with screening mammograms.
I love it. I love it. Listen, ladies, Dr. Bole is coming here dropping gems today. So you should be able to walk away with a lot of information that you can utilize on your next doctor visit. So make sure you do that. Dr. Bole, it was an honor to have you here on All Talk Oncology, and we are making sure that we empower you ladies out there.
Yeah.
And remember this, you're not alone in this. We're in this together. This is Kenny
Absolutely.
Perkins, AKA your cancer guy. And until again, we're out.
So stay connected with us on All Talk Oncology Cancer Podcast. Make sure you subscribe to that, right? Wherever you listen to your podcast, whether that's Apple, Spotify, make sure you subscribe and continue to spread that word, right? Engage in this, because your engagement can help someone stay alive. And this is what we're talking about. So again, make sure you subscribe, hit that subscribe button. Again, this is Kenny Perkins, aka your cancer guy. Until again, I'm out.